Direct Relief is a humanitarian aid organization that focuses on bringing medical resources to people who typically can't afford them around the United States and around the world. We work in support of locally run organizations in all 50 states and with local health projects, hospitals and clinics in 70 countries, bringing resources, whether they're medications, supplies, vaccine, or instruments that they need to take care of people who typically can't afford to pay. Over the years, we've done a number of different things at Direct Relief, including sending medical volunteers, increasingly gathering and publishing information that can be generated from now a vast network of partners. But again, the purpose of it is to make sure that people have access to health care when they're sick or hurt and can't afford it. And that's a chronic problem and that gets exacerbated in emergencies. So we're active both on a day-to-day basis for people who are always in need, and then have a rapid response activity for those emergencies when many more people get pushed into crisis.
Not only can we react quickly, but Direct Relief has the support of hundreds of healthcare companies and pharmaceutical companies whose first call is to Direct Relief to say, how can we help? What are you guys doing and what do you need? I think because Direct Relief is so well known and trusted, we're the first responder in so many of these disasters around the world. And we always have people on the ground who we know, who we trust, and we vetted and can get the supplies to them as quickly as needed.
As an organization, Direct Relief is best known for the disaster relief work. And I always say if it bleeds, it leads. And it's because, on the worst day ever, whether it be a typhoon, whether it's an earthquake, or even the Ebola situation now in West Africa, that's when the news media are showing up in the warehouse and they want to talk about the work that Direct Relief is doing as a result of an urgent crisis that is facing a part of the world. That piece of the work is a very, very important piece of Direct Relief's work, but it only represents on average about 15% of what this organization does on an annual basis. It's only because Direct Relief is doing this work every single day to really help support the health needs of people across this country, in the United States, and across the world, that the organization can respond on the worst day. We always say you can't do in emergencies what you weren't doing the day before. And it's because Direct Relief is pressure testing the system and is working to improve the health and lives and get better access to essential medicines and supplies for people in urgent need every day, that Direct Relief can respond effectively on the worst day ever.
Yeah, one of the things we recognize at Direct Relief is that these mechanisms that exist to share information or to kind of automate or really target resources. I mean, we're very good as a species of figuring things out: transportation, communications, medical inventions, and much of that is just done routinely in the commercial realm. But the contrast is when you get into poor areas that many of the same needs exist, but none of the activity exists because there's not a profit incentive for the people who do it well to engage. And so what Direct Relief has tried to do is recognize that, well, there may not be a strong business case for engagement everywhere, but there's a very strong human case to help people who need medical attention so that they can be healthy and advance themselves. So how about trying to encourage the participation of people, not because it's necessarily going to be profitable, but because what they do well is needed really even more so in the areas that have fewer resources.
Really what Direct Relief has built over the past 60 years is a platform by which we are able to network the medicines and supplies to people and really derive those to people who are in urgent need and enable physicians to order precisely what they need. So here in this warehouse, there are thousands of different products. They're precisely tracked, map tracked and measured through an IT platform that we run called SAP. It really enables the precise mapping, tracking, and measurement of every single product that leaves this warehouse so that we at Direct Relief can provide a high level of transparency to our product donors, to our individual donors, to the foundations that support and participate with Direct Relief around where the aid is going. We're able through the system to track all of the products through our logistics as well as financials and provide a great deal of transparency behind the work of Direct Relief.
A number of leading companies in the world work with us to try to accomplish things of kind of mutual interest, tapping the resources that companies have, whether it's a healthcare company or a technology company or a transportation company, and we invite them all because pretty much all those things are needed in the non-commercial market just as they're needed in the commercial market.
So for about the past 60 years, the focus has solely been on really improving the health and lives of people in need. So the gentleman really focused on doing one thing really well, and it was focused on health care, improving access to basic medicines and supplies that could really improve people's lives. And they started encouraging the participation of companies. And that continues to this day, is a standard that was set decades ago with companies like Johnson & Johnson, has been one of the largest term donors to Direct Relief. They've been donating medicines and supplies for over 50 years to Direct Relief. And it has now grown into one of the largest efforts of its kind, whereby there are dozens of medical manufacturers that donate everything from Band-Aids to flu vaccines, antibiotics, to oral rehydration, diapers, and really the resources that are mobilized here are all sent to people in need across the world. So here today at Direct Relief, we're packing over 2,000 personal care packs. So we have volunteers from the community, much in the Direct Relief way of how we get things done, whether it's private contributions with cash donations or companies that donate personal care products or medicines. We have hundreds of volunteers that have come here today, including lots of students from the local community, to help us pack these personal care packs, which will go to homeless families throughout the county this holiday season. So typically we build these packs twice a year. We do one mid-year and then we do them around the holidays as well. And we distribute them to dozens of agencies across the county. We often send these types of packs when people have been displaced by an emergency. And we also provide them to hundreds of families and actually thousands of people in this community during the holidays who are in homeless shelters and are on the streets. In Sierra Leone, Direct Relief has been working for several years to improve the health and lives of moms and babies. Maternal mortality across this world is still way too high. There are about 300,000 women that die in pregnancy and childbirth every year. Obviously, the majority of those are in areas where women are most vulnerable, women are poor, and lack access to life-saving healthcare services. In Sierra Leone, Direct Relief has been working for several years with the McKinney School of Midwifery. In McKinney, they're working to equip midwives and train them so they can provide essential access to care at birth. They can provide essential prenatal care to pregnant women in rural communities. And ensuring that for Direct Relief that they have the equipment that midwives need to do their job.
In the case of the Midwife Kit program, interestingly, it's now the global standard for what a midwife kit is. And in the United States, I think the Medical Reserve Corps pack that we developed just so we could help at a more larger scale level became the standard for California, which is the largest, most populous state, and was awarded the top award by the Office of the U.S. Surgeon General twice. And we'd like now to make sure every Medical Reserve Corps member in the United States has access to a pack that's been vetted and tested and field tested and deployed and standardized.
So in response to the worst Ebola outbreak in history, Direct Relief felt that our response needed to be equally large. So we chartered a 100-ton 747 to send 100,000 suits of personal protective gear, 40,000 liters of oral rehydration, and 2.2 million pairs of gloves to get to the affected region. Again, this is the worst Ebola outbreak in history, and we felt the response deserved that kind of support, and it wasn't happening. Direct Relief stepped in because we felt someone needed to do it.
So the challenge is really to grow and do more of what works, and to have the capacity to do it and the participation of others.
And so what Direct Relief tries to do is ensure that there are talented doctors and nurses that are caring for patients in impoverished parts of the world, including across the United States, in our most vulnerable areas, that they have the opportunity to provide excellent quality care by giving them the life-saving essential medical resources they need to care for their patients.
These people who have just suffered some of the worst injuries and damage to their home don't have access to these medicines and supplies that they need. And Direct Relief is that bridge between the companies, the essential medicines, and these people that nobody is really looking after because they can't buy this stuff. And so we're providing that link.
It's a massive, I think, collaboration of business, individuals, private foundations coming together to really help improve the health and lives of people across the world.
I was really touched when I saw myself helping in shipping medical material to West Africa to help fight Ebola. It was a great privilege for me to be part of that shipment, and it was very timely, it was very helpful, and I believe they will always live to remember Direct Relief and what we have sent to them.
And we love the challenge of inviting and encouraging companies and people to get involved in some of this work that's really important. That we all know when we're in the first grade, it's important to help people and to do it in a way that makes sense with the tools we have today and the times we're in. It's a daily opportunity and challenge to see how we can do it better.